Welcome and thank you for joining us for today's COVID-19 update. I'm Felicia Valenzuela and we're speaking with the Honorable Minister of Health, Dr. Frank Anthony. So let's talk about equipment first. Give us an update as to what's happening in terms of getting all the hospitals and the health centers what they need.
Well, a couple of things that we are doing. In terms of equipment, we have placed a major order for several types of equipment. So you know that at Ocean View, we want to equip that hospital to make sure that it functions like a hospital. And we have ordered all the equipment to ensure that we have diagnostic facilities at Ocean View, that we'll be able to set up an ICU at Ocean View. We are looking at 29 ICU beds there. We have a theater there that we want to equip as well, so that if there's any need for us to operate on anybody, we'll have the conditions there to do that. So we have ordered all the equipment that is necessary for Ocean View, and this morning we had a team that went into the Ocean View space to look at putting in the gas, the lines for the oxygen and other things that we'll need for the ICU. So they have done that preliminary assessment, and we are hoping that we can get that up and running as quickly as possible. Some of the types of things that we'll have to use there, we'll have to import them, and so we are working with the supplier to be able to bring that into Guyana. So that's one set of equipment. In addition to that, we had placed order to bring in ventilators, because you know one of the big challenges with COVID patients is that they would need ventilation. And therefore ventilators become one of the necessities. We had, through the Indian government, they had given us $1 million US, and we used part of the money to buy 29 ventilators. We had received the first 5 ventilators, which we gave to Georgetown Hospital, and we are getting another 21 or so on the 12th, which is Monday. So the rest, this 21 ventilators, we should receive on Monday. Those ventilators, once we get them, we'll be doing 2 things with them. We'll be adding some more to the Georgetown Hospital infectious disease ICU, and we will be sending out the rest of the ventilators to the different regional hospitals. As it is right now, many of the regional hospitals do not have ventilators. And there are 1 and 2 that was given ventilators, but they're not working. So we now are going to build that capacity in the region by sending ventilators out to them. So that's another set of equipment that we are getting in. In terms of our testing capacity, we have a number of PCR machines. We have what you call biohazard cabinets. That's the cabinet where you will process these samples. However, our challenge has been getting someone to come from Canada to certify the cabinets. So we're making progress with that, and hopefully that person would come to Guyana and be able to certify those cabinets. Once the cabinets are certified, we will have more capacity to do many more tests than we are doing right now. In addition to that, the machine that we currently have to process the sample, it takes about 8 hours. So we have received a donation from the government of China, and that is for what is called an automated extractor, meaning from the samples, this machine is able to automate the process of extracting the samples and process the samples for us. That piece of equipment is right now at the National Public Health Reference Lab, and the technicians there, the laboratory specialists that we have, they're working to install that machine and to do some test runs. So I would average maybe by next week, we should have that machine up and running because they have been working on trying to get that going. Once that machine is up and running, we should be able to process more samples and do it faster. So that's going to help with improving the capacity of the lab. We have also been looking at what we call point of care testing, and these are tests that you don't require a laboratory setting, but in some cases you can have a small piece of equipment that can test right there and give you a result maybe between 45 minutes to an hour. So the WHO has recently certified one such machine, and we are in discussions with them to see whether or not we can acquire those machines with the relevant kits to go with the machine. And if we are able to get that, then we can deploy these machines to regions because they really don't need a laboratory setup, and we'll be able to test more people. These machines really, it would check for the virus, but it's not a PCR test, but nevertheless, they're very accurate. If, however, from these results, if we have what is called an indeterminate result, then we can always go back to our PCR. So what we're doing is building capacity for varying types of tests, and if necessary, we can move from one to the other quite seamlessly and have enough so that whoever needs a test would be able to get a test. So shortly, we expect to be in that position.
All right. Minister, I know your frontline workers are very important to you in this fight against COVID-19. What about protective gear for them? Are we up to date on that?
We have, and we have been buying continuously. So when we came into government, we bought literally thousands of N95 masks, surgical masks, which we have been distributing to all our frontline workers. We brought in about 30,000 face shields, which was distributed. That's a lot because I don't think we have 30,000 health workers. But they've all been distributed, and we continue to buy more face shields. Face shields is just one example because that's reusable. You clean it and you can reuse it. N95 mask, depending on the duration of use and so forth, you can use it for a prolonged period, and there are requirements and so that one should comply with. But generally, when we issue these things, our health workers, they use them and then they discard them because these are disposable items. Similarly for gongs, similarly for hair covers, shoe cover, and so forth. So we have been constantly buying, and I recently saw an order that we have just put out again to acquire literally thousands of these things. One of the challenges that we have, however, is that when these things are issued to some of the hospitals, we notice that the quantities are going down quite quickly. And we believe that there are people who are taking advantage of the system. Some people are stealing some of the supplies, and that's something that we have to constantly guard against. So these are things that we have to monitor, because knowing how much we have bought and how much we are distributing to hospitals, they should have always enough stock. Another thing that we have said to all our hospitals is don't wait until your stocks are depleted to reorder. You should have what is called a threshold stock, and once you hit that threshold, you must be able to order, and so that we can resupply or restock what you have already used. And so this is an ongoing exercise.
All right, Minister, in terms of updates, can you tell us what's happening at the Lusignan prison?
Well, Lusignan prison, as you know, we had about, I think, 290-something cases there. Fortunately, most of those cases now are much better. They have been discharged from they no longer have any active COVID, or are they infectious. As of today, I think we have, the last count I saw was 90-something persons, and many of them would be discharged today as well. So from a medical point of view, they are no longer infectious, and we can return them back to Lusignan. So that's something that the personnel who's been manning the isolation center and the prison authorities would have to discuss so that they can return these persons who have been discharged back to the prison setting.
All right, and Operation COVID Curve. Could we just get a brief update as to what's happening with that? And for the, in terms of persistent non-compliance, like if you experience that, what is in place to deal with that?
Well, Operation COVID Curb, I think, is going quite well. We have received quite a lot of positive feedback, and we are very pleased with the comments that we're getting back. The police, the army, the CDC, and other volunteers have been out and talking to people. So we are trying a softer approach, talking to people, distributing masks, giving out flyers, educating people. We feel that this approach would work, and the more people understand how they can get the virus, the more they would want to take precautions. There are some nuances. I guess in conversations you can convey those nuances to people, and I think so far the feedback has been a positive one. We will continue to expand, and one of the things that we want to appeal to persons, if they want to volunteer to help us with doing this mass education, they can contact the Secretariat so that we can coordinate with them. If you want to volunteer and you want to volunteer in your community, we'll give you the materials so that you can help us to distribute the material in your community. So these are things that we are working on, and we would really like to appeal to people who have the time and who would want to give some of their time to help educate others, that they can contact the Secretariat. In addition to that, if you observe that there are breaches of the order, then we have the hotline numbers. We'll make sure that all those numbers are circulated so you can call the hotline. And in addition to the medical personnel that we have manning those lines, we also have the police is present at the hotline center, and they do the same 3 shifts. So you have police that are there for the 3 shifts. So if there's a call that comes in, say that people are gathering somewhere and they're not observing the guidelines, then the police who is on duty would call the respective station within that community and get the patrol to go out and talk to the people. So that too has been a welcome change, because I know a lot of people have been complaining that the enforcement is not working, but this is really an effort for us to change that and to get people reporting to us and then allowing the police to take some form of action. So I think as we do more of this, we will get more people to comply, because it's a combination of educating, getting people to understand how they can get infected, and getting people to take the right action. So I think we are slowly getting there.
All right. As you mentioned, take the right action. I know a particular concern is the time it takes people to go to the hospital when they think that they're probably contracted COVID-19, or if they're experiencing any kind of symptom.
Well, one of the challenges with COVID-19, if you're tested positive and you're in home isolation, we have noticed that patients can go from being quite normal to having respiratory difficulty very rapidly, right? So within a very short period of time, people can be like normal and then they change rapidly. So it is important that if persons who have tested positive or they have signs and symptoms of COVID, if they have such a sudden change where they start having problems breathing, it is absolutely necessary that you get to a health institution like a hospital, because there you would be properly assessed, and if it's necessary, they would then put you on some form of ventilation. But the main thing is for you to be properly assessed, and then the medical personnel can be able to manage you better. If you delay that, then you can end up with respiratory difficulty, and you can literally die because you're not getting enough oxygen into your system, right? We don't want that to happen. We want people to get to the hospital and give the medical personnel an opportunity to provide treatment, to be able to care for you so that you can recover and be good.
All right, Minister, just lastly, without putting you on the spot, I know you care very much about your frontline workers and the health workers in this country. We know that we've read that the JPSU, they've suspended it, but more so their industrial action actually. So how important is it to have this issue resolved?
Well, I think it is very important, and I'm happy that the GPSU has agreed to abandon their protest action, and I think it speaks to a certain level of maturity, because we're in the middle of a pandemic, and we need all hands on board. This, while the healthcare professionals are going to do their best to manage this, the whole society got to be involved. Of course, our healthcare professionals are the ones who would have more in-depth knowledge of this disease, and they're expected to care for people, to help people when they get sick. And they have been doing a fantastic job since this pandemic has started. And, many of them have been trained to do these things, so they want to bring that professionalism out. And I have really met some wonderful people during this short time who really go beyond the call of duty, trying to make sure that patients, are cared for, and that's what nurses and doctors and other healthcare professionals do. That's, that's why they do it. So I am really happy that this decision was made, and that we will work to resolve whatever issues come up, and we can do that in a very cordial way, because all of us want the best for our healthcare workers, and we have to work together to improve the system.
Thank you.
Good.
Thank you for joining us. This has been your daily COVID-19 update. Remember, for more information, log on to our website, dpi.gov.gy, and our social media platforms, as well as the Ministry of Health's website.